bradyarrhythmia, let's talk about bradyarrhythmia. So how do we define bradyarrhythmia? Bradyarrhythmia when the heart rate is less than 60 beats per minute. Now, and PQRS pattern is not followed. And bradycardia is heart rate less than 60 with PQRST pattern being followed. Now remember, when the heart rate of the patient is below 60, it is not necessary the patient would be symptomatic. Normally, when the heart rate is below 40, then only the symptoms start appearing. And if the bradycardia or bradyarrhythmia is asymptomatic, normally we just monitor, we don't treat, right? So, definition of bradyarrhythmia is that first bradycardia, I would say, bradycardia, heart rate less than 60 beats per minute with PQRST pattern being followed, and all the intervals, PR interval normal, PR interval is within normal range. So within normal range means, so we should know the range of the PR interval, it is between 0.12 to 0.2 seconds, right? So this is the normal PR interval, okay? Now bradyarrhythmia is heart rate less than 60 beats per minute and PQRST pattern may or may not be followed, and PR interval may not be normal, PR interval may be abnormal, okay? So let us talk about different types of bradycardia and bradyarrhythmia. Apart from this, we need to know one more thing, symptomatic, asymptomatic bradyarrhythmia. Symptomatic or asymptomatic, right? So simple, if we literally go for what we have written, asymptomatic means no symptoms. And symptomatic means when the patient is having symptoms because of decreased cardiac output. Because of low cardiac output, patient is having symptoms like patient is having decreased blood pressure, so signs of shock, patient is having acute heart failure because of ischemia to the heart, patient is having the clinical features of chest pain, patient is having altered sensorium because of decreased blood flow to the brain. So this makes it symptomatic, right? Symptomatic bradycardia has to be treated, and asymptomatic is mostly has to be observed. So let's talk about different types of bradycardia. Types of bradycardia, right? So first is your sinus bradycardia. We'll talk about sinus bradycardia. Then we will talk about the heart blocks. Now heart block can be at any level, at the level of SA node, at the level of AV node, at the level of your bundle of His, right? It could be at any level, right? Heart block is of three types. The first degree heart block, second degree heart block, which is of two types, Mobes type 1 and Mobes type 2, right? So we have first degree and second degree heart block, first degree heart block, then second degree heart block of two type, Mobes type 1 or Venke Bach, and Mobes type 2. And then we have third degree heart block or complete AV dissociation. So these are the different types of heart block. So one by one we'll study. Let us start with sinus bradycardia. So how would sinus bradycardia look on ECG? The first thing, that sinus bradycardia is SA node dysfunction. The originates from SA node. So it is SA node dysfunction, and number of time it is because of manifestation of some other condition. We'll talk about what condition. So it originates from SA node. Heart rate would be less than 60 beats per minute. It would be less than 60 beats per minute, right? So heart rate would be less than 60 beats per minute. Then rhythm would be regular. rhythm would be regular. So we will get regular RR interval. Then PR interval. PR interval would be within 0.2, 0.12 to 0.2. It would be less than 0.2. So it would be within 0.1 to 0.2. Right. So it would be within the normal range. It would be towards the higher range because heart rate is less, but it would be within the normal range. Then it is called the sinus bradycardia. And every P is followed by QRS complex. QRS complex. So every impulse from atria is going to the ventricles. So all the impulse is going to the ventricles. So this is sinus bradycardia, and mostly the origin is from SA node. It is caused by sinus node dysfunction. And multiple causes can lead to the sinus bradycardia. Like the causes of sinus bradycardia is if the patient has raised intracranial pressure, then autonomic reflexes, Cushing's reflex cause sinus bradycardia. So increased intracranial pressure. In obstructive sleep apnea patient, prolonged apneic episode can cause sinus bradycardia. So prolonged apneic episode in case of obstructive sleep apnea. In case of myocardial ischemia, we can get the sinus bradycardia. Then in case of hypothyroid patient, in case of hypothermia, in case of hypercapnia, acidemia, and certain infection can cause sinus bradycardia. Apart from it, some of the drugs can cause SA node dysfunction. So some of the drugs can cause SA node dysfunction. Your sympatholytic drugs like clonidine, dexmedetomidine, they can cause. So sympatho or beta blocker, main one, the sympatholytic drug, right? Then calcium channel blocker like verapamil, diltiazem, calcium channel blocker. Then amiodarone can cause, and then parasympatholytic agent. So number of drugs can cause. Now there is a definition of there is something called sick sinus syndrome. Right? Now, sick sinus syndrome is intrinsic SA node dysfunction, right? Sick sinus syndrome, right? I'll just talk about it. Sick sinus syndrome. In this, there is intrinsic SA node dysfunction. Intrinsic SA node dysfunction. This may result in decreased cardiac output, right? Intrinsic SA node dysfunction. Then there is something called tachybradycardia syndrome, right? Tachybradycardia syndrome. Now this is happening because of when we are giving the drugs, the AV nodal blocking agents to the patient in atrial fibrillation, and their prolonged effect is being seen. So after tachyarrhythmia, prolonged bradyarrhythmia. So tachybrady syndrome. So this is seen in the atrial fibrillation treated patient, right? The prolonged period of depression of the SA node. So we call it tachybradyarrhythmia syndrome. Now management of sinus bradycardia depends upon the symptom. If the symptoms are coming, the drug of choice is atropine. So management is according to the symptom. So we will talk about the management more. The drug of choice in case of symptomatic sinus bradycardia is your atropine, and asymptomatic never has to be treated. Dose of atropine I would discuss further. So this is sinus bradycardia. Now let us talk about first degree heart block. Now exactly this is not a heart block. Now this is just a AV node delay. The delay happens in the AV node, and the only difference of sinus bradycardia from first degree heart block is PR interval, which gets prolonged in first degree heart block. So here also in first degree heart block, there is a delay in the AV node. There is a AV block, or we shouldn't call it block, just a delay in AV node. So what happens? The rhythm is regular